So my name's Sharon. I work for AMSANT, which is the peak body for all of the Aboriginal community controlled health services in the Northern Territory, and I'm employed as a workforce policy officer. I've been an Aboriginal health worker practitioner for about 22 years. Now I'm working in policy, so I have a fair bit to do with research, a lot of projects going on, looking at growing our Aboriginal workforce in the Northern Territory, and legislation to do with tobacco control, child protection. I'm involved in some cancer projects, so National Indigenous Bowel Screening Project. Majority of my role is helping support and grow our Aboriginal health practitioner workforce, which is struggling. Nurses are trained in the acute care, so in the hospital system. Aboriginal health practitioners are primary health care practitioners. So we're all about prevention. If you go to an Aboriginal medical service, you can go in and say you've got a sore throat, but they'll check your blood pressure, check blood glucose levels, see if you're up to date with your immunisations, check your weight, see where you're at with, if you smoke and if you're thinking about quitting yet, some brief intervention, the holistic look at your health and well-being. Being an Aboriginal health practitioner, you have to be willing to be going to people's home, meeting them where they are. If that's down the beach, under a tree, in the park, it's meeting people where they're at. It's not sitting and waiting for them to come to you as well. We like to get involved in health promotion on Close the Gap Day, World No Tobacco Day. All those sort of things are all part and parcel of being an Aboriginal health practitioner. You need to be a caring person. You have to be very patient. The Territory gets a lot of fly-in, fly-out type health carers, and often they bring their own worldviews. They don't understand the culture. Sometimes personal health care is not on people's top priority. It's other social things that are going on, financial, cultural obligations, things like that. So being an Aboriginal health practitioner, you already have that understanding, what's going on with our mob. So you have that bit more compassion, a bit more patience, and we really try to empower our own mob to take care of themselves, to look after their own health. It is a generational thing, so we have lots of health practitioners that their mum was an Aboriginal health worker and their grandmother and their auntie, and we need more males. We've got some really strong males at the moment that are coming through. Those numbers are changing, which is really good, because we need to support our blokes more. There's things like men's sheds and strong bulla in Catherine, which is really supporting the men to take back their role as men in their family and their community. To become an Aboriginal health practitioner, you need to have the literacy and numeracy levels to be able to practice safely. There's protocols that you must follow. If they become immunisation providers, they have to be able to document things very accurately, and as well as write in patient files, patient notes, and administer medications. So they have to be able to calculate medications, injections, all that sort of thing, as well as English not being people's first language, so that can be hard. If you care about people and care about health and want to make a difference, a lot of people do it because of, we see our old people dying at a young age. If you want to make a difference, then now's the time to apply. It's the Certificate 4 in Aboriginal and Torres Strait Islander primary health care practice. It's offered nationally all over Australia. There's more and more RTOs that are accredited now, so that when you graduate you can become registered. And there's just lots of work going to improve the profession as a whole. We've got some very senior health practitioners that have been health workers for 30, 40 years, and they're not just a clinician, but they're a leader in their community, they're an elder, so they have those other roles that they take on, which you can't just get from that fly-in, fly-out type person. If you want to become an Aboriginal health practitioner, just do it. There's lots of support out there. It may seem like there's not, but there is, and you'll never be without a job because we need more. There's lots of vacancies, yeah.